health equity is a big priority for Health Partners, and you have a number of different subpopulations that all seek service at your clinic. So how do you target patient outreach to really address the care gaps in those subpopulations?
Yeah, it's a tough one. I'd say first off, I'm going to go back to my first 4 points. It's relationship building. So before you can do anything, you need to understand what are the ideals, the beliefs, and also the goals for each of these populations. I think traditionally what we've done in medicine is we have come up with what we think is important, and then we've impressed that upon our patient populations, regardless if they come from either a so-called minority or majority group. I think going forwards, we need to continue to partner with our patients and also with their local communities to understand what they think is important. By doing that, you're going to build the trust. By doing this, now we can have shared decision-making ability, and we can help them understand what we think is important, but also make sure that we're addressing what they do. So that's kind of the, I'd say, conceptual first step. Once you start building that trust and you get that engagement, I would say from an operational standpoint, we do have a pretty robust data and measurement team. And this allows us to track quality measures, and we track almost every quality measure, both overall, but we also break that into subpopulations. And this includes our Medicare, Medicaid population, which we use as a proxy for people who may have some disadvantages in terms of a socioeconomic disadvantage. And then in addition, we track it also by race. And so by doing that, that allows us to find out where are our health disparities so we can attack them. Once we know where our disparities are, we can then use our central outreach teams and also our clinic-based outreach teams to reach out to the patients. We do this in a bunch of modalities of formats. We do it by telephone. We do it by online. We actually have even found one of the best ways is using social media, interestingly. So we have at times found that there are zip codes where we are having problems. So we can do social media's blast, just those specific zip codes, interestingly. And then once the patient, if we can get them in, once they arrive, it comes back to trying to remember to close all care gaps and do everything at every visit. So I think this is important because once we get this patient in, we might get them in for, let's say, breast cancer. That's where they've popped up on our registry work. But once they get them in, we should do the breast cancer. We should also do the colon cancer, and we should do immunizations.
Well, thank you, Jason. That's a great answer. And I really look forward to seeing your TikTok dance video on vaccine immunizations on social media. That's actually the first time I've heard of a medical group using social media to close care gaps. So what a great insight.